And we know discharge begins at admission. And when the member gets to the point where they're looking more likely to go home, that's when our discharge planner is now using those same types of guidelines. Okay, well, how, if the home health care agency sends in a prior auth request, for example, and their request is for 8 hours a day, 7 days a week, which we see often enough, we use those guidelines to make that decision, that determination as to what is it that's happening with this member that will require them to have 8 hours of visitation 7 days a week. And so this MCG helps us to understand when they are going home, they may need, physical therapy, they may need occupational therapy, and of course, having a home health aide, you would have to have some type of skilled need. You can't just put them in there, and that's something else that MCG helps us to use as our rationale in the event that we have to make an adverse determination. For those members that are requesting just having a home health aide, they have to have a skilled need. So when our discharge planner is using that and explaining to the home health care agency as to why the member doesn't require 8 hours a day, 7 days a week, but we're more likely looking at we would recommend four visits, or according to the MCG guidelines, it says that we should see them, they would use 2 visits as opposed to 56. Now, they're not all happy, and we know that's just the reality of things. They're not happy, the member's not always happy. But when we're talking about utilization management, we also don't want the member being taken advantage of, and that just happens. So we want to make sure that when we're sending out those denial letters, that it's crystal clear in explaining why you did not meet those, you didn't meet the requirements for that guidelines, and it spells it out because you did not have this or you did not have that. So because you didn't meet these guidelines or because you didn't meet these requirements, we're allowing you this many. So it's not a total denial. However, it's a partial approval. So we're not saying you don't need help, but we're saying you do need help, but not as much as they're requesting. So, using that home health, the home health care guidelines is very helpful, especially with that.